This webinar aims to inform how to use early years profile data to influence health visiting practice. And it's brought to you by the Institute of Health Visiting as part of the Making the Most of Health Visiting programme, which aims to support the continuing professional development of health visitors. This webinar provides a brief overview of early years profiles and should be used in conjunction with this Guide to Early Years Profiles, which is a document published by Public Health England and NHS England in 2014. As health visitors, we're aware of how critical the 0 to 5 period is in shaping health and well-being throughout life. We understand that improving outcomes for children, families and communities, as well as creating services that provide better access and experience, are essential. And that giving every child the best start in life is crucial to reducing health inequalities across the life course. So using early years data to inform us of the health inequalities that exist within our local population is essential to support our health visiting practice. The early years profile data can support health visitors to focus their interventions on areas of greatest need and support their leadership role in improving health and well-being of the population they work in. The data can also support commissioners and providers in understanding the timescales from effective intervention to improved outcomes. It can also be used by health and wellbeing boards in the development of their joint strategic needs assessment and their health and wellbeing strategy. Using the profiles, you can see at a glance how your local area performs against key indicators. You can also compare the data with other local authorities and nationally. Baseline and trend information are provided where available. The early years profiles are displayed in 4 views. Firstly, the Early Years Profiles England, which shows national trend and baseline information. Then secondly, you have the Early Years Profiles Local Authorities. This allows you to compare performance against other local authorities as well as nationally. Thirdly, you have the Early Years Profiles Indicator view, which allows you to compare performance by individual indicator with other local authorities and nationally. These include maps and time series charts where available and bar charts. Then finally, you can pull together a topical report which presents a local picture helping you to interpret and act on the data. The early years profiles can be found on the Data Gateway website. Just type in datagateway.phe.org.uk. Then select the Child and Maternal Health category. Now click on Early Years Profiles. You will see this screen. Now select which early years profiles you wish to view, either England, local authorities, indicator view, or to process a topical report. The Early Years Profiles England shows national trend and baseline information where it's available. As you can see, the screen is divided into 3 tables. 2 tables on the left and 1 large table on the right. The top left-hand table provides you with a list of indicators for you to select and identify the national trend or baseline information. When you select an indicator, a trend chart for that particular indicator is then shown in the table below. The indicator selected on this screen is under 18 conceptions. The large table on the right-hand side has 4 columns. The first column is the indicator name along with the year in brackets. The second is the value column. This shows the latest available value for that particular indicator. The third column is the baseline, which shows the value of the indicator in the baseline, which was 2010. The final column highlights the direction and extent of the statistically significant change from the baseline year, and this uses symbols which are shown in a key. The red upwards facing arrow indicates a worse trend than the baseline, whose value is increasing. The red downwards facing arrow indicates a worse trend than baseline, whose value is decreasing. The neutral line indicates no significant difference between the baseline. An upward-facing green arrow shows a better trend than the baseline, whose value is increasing. And the downward-facing green arrow shows a better trend than baseline, whose value is decreasing. The grey line shows that the value could not be calculated. The example here shows that under 18 conceptions, the value is 27.7 per 1,000 females aged between 15 and 17 for the year 2012. The baseline at 2010 was 34.2 per 1,000 females. So you can see the trend is better than the baseline with a decreasing value. The early years profiles in the local authority view gives you a more detailed view of how a local authority is performing compared to the England and regional values. When the profile opens, select the area or areas that you're interested in from the list shown. As you can see, I've selected Staffordshire and then I'll select Blackpool. If you're only interested in your own authority, then just select that. Now click the Show Hide tab so you can see the complete table beneath. As you can see, the table has 7 columns. The first column is on the left and that shows different indicators associated with early years. Column 2 shows the area or areas that you've selected, and as you can see, I have selected Blackpool and Staffordshire so that I can make a comparison between the two. Column 3 shows the value for a particular indicator, and column 4 shows the baseline for that indicator in 2010. Column 5 shows the trend between the value and the baseline, and the View Key tab shows you what each symbol means. Column 6 shows the average value for England, and column 7 shows the performance in the form of a spine chart, which goes from the lowest value across all areas to the highest, so that you can see here the lowest value across all authorities for teenage conceptions is 14.2 per 1,000 and the highest is 52 conceptions per 1,000. This spine chart has 3 colours: green, yellow and red. Green represents good, showing a range of authorities which are performing well compared to the England average. Yellow represents average, showing a range of authorities which are not significantly different from the England average. Red represents poor, showing a range of areas which are performing poorly compared to the England average. On this bar, the England average is shown as a red line. The regional value is shown as a grey diamond, and the local value as a black dot. So for under 18 conceptions here, you can see that Blackpool is performing poor, worse than England average, with their black dot in the red bar. However, Staffordshire's performance is average, with little difference from the England average, and their black dot is in the yellow bar. As you can see, comparisons can be made for all indicators. Finally, the small icon in the right of each indicator will show you how and where data was collected. Early Years Profile Indicator View allows you to compare performance with other local authorities and nationally by individual indicator. The information in this view is displayed on a map, a time chart and a bar chart. You can click on the Select Data tab to select the indicator you're interested in. Where information is available for more than 1 year, these will be displayed with the most recent on the top. Here you can see under 18 conceptions has data for a number of years, with the most recent in 2012 on the top. Use the Select Filter tab to display information in one geographical area or Public Health England centre. I have selected the West Midlands. Once you've selected the indicator you wish to view, a map of the British Isles will be displayed, with the region you've selected shown in colour. Here you can see under 18 conceptions shown in the West Midlands. In the top box on the right hand side you will see a list of authorities that can be found within the regional area you've chosen. The larger box on the left hand side controls the map, including colours used and their values, and allows you to make changes to the map's appearance. To change the colours on the map and the classes, click the cog icon. This box also displays a range of values for the indicator selected, ranging from the lowest value at the top to the highest at the bottom. If you select the lowest range value, you can see the names of the authorities within this range are shown here in the right hand side. You can select any of the other ranges to identify which trusts fall into these values. If you wish to look at only one authority, clear the names using this function and then select the authority. As you can see, I've selected Birmingham. You can now see a large map has changed to show Birmingham outlined in red. The time series chart at the bottom now displays the indicator data for Birmingham over a series of years. The bar chart at the bottom shows Birmingham in relation to other authority areas, and Birmingham is outlined in red. If you wish to make comparisons with the England average, then click on the England tab here. You can see a comparison line in both time series and the bar chart. The bar chart shows a range of values for the indicator you've selected, with the lowest value on the left moving to the highest on the right. The narrow box in the centre allows you to select data from a particular year only. This will change the bar chart to reflect the values for the selected indicator within that year. You can print a topical report that will present a local picture, helping you to interpret and act upon data and supporting your effective interventions. When you click on the Topical Report tab, you will see this screen. To see the report you want, choose a local authority area from the drop-down list. As you can see, I've selected Barnsley. This is the report for Barnsley. It can be converted into a Word or PDF file for printing. This ready-made report allows you to copy and paste text, tables and charts into your own presentations and reports. But please acknowledge the Child and Maternal Health Intelligent Network and Public Health England as the source for your data, and state the date you access the data. This webinar is brought to you by the Institute of Health Visiting. Thank you for listening.